The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. Very excited for today's show. We're always grateful and thankful when doctors take their time to come on the program to share with other doctors. So let me thank you. Dr. Aaron Nichols, thank you for being here.
Thank you, Patrick. It's good to be here.
Yeah. So let's start. Give us the background, that question we always ask. How'd you get involved in dentistry? How'd you become an expert?
Got involved in dentistry after going through every other major while I was at college. And I had an uncle who was a dentist, and I worked for him one summer. And it seemed like it was pretty interesting. And so I went ahead and applied, went to dental school, and I graduated a while ago. I graduated in 1988 and started or 87, started to practice in 88. I immediately almost went bankrupt because you have to remember that we didn't have the internet, which means there's no social media, there's no YouTube University, there's no internet. So everything you found out came out of a magazine or a direct contact. Just by happenstance, happened to run into my first consultant that I ever used. They got me kind of squared away because, as is still true, they don't teach you much about business in dental school. They have enough trouble teaching you the dentistry, much less the business end. So that really helped out. I was with them for quite a while, and then I've had a series of coaches and consultants since then. And the last one that I worked with looked at me after a while and said, you don't need us, right? And I was like, yes, but I need someone to make me do what I know I should do. And that's what I want you for. And so we cooked along for a while. And eventually they said, if you'd like to help some other docs out, I really think you could. And remembering how awful my experience was getting started, I was like, absolutely, I'd want to try to help somebody else out. So that was the DSI guys, Dental Success Institute. And so I spoke at the second summit and maybe for the next 6 or 7. And at one point got asked to be a coach with them. So I was their first, what we call a Blackbelt coach. And from there, I ended up kind of branching into teaching some clinical stuff simply because I kept, as I was coaching, I kept hearing the same stories over and over again about the issues they were having, and then eventually created a hands-on course and eventually started an online clinical coaching group, all because of interacting with these guys and seeing the problems they were having and the problems they were having trying to solve that issue. And I said, there really isn't anything out there. Let me create it. And so that's kind of how I got here.
So overnight success is what people or some people are hearing, right?
Yeah. It only took 34 years. It was great.
Yeah. So, you mentioned in there, and I've done plenty of consulting in my life. And, you mentioned that people were telling you things that you already knew. And a big part of consulting is telling people what they already know, but that missing piece in there is actually getting people to practice what they already know, to do it over and over and over again, so they become masters at it, so they become experts at it. I'm assuming some part of Monday Morning Dentistry, and by the way, the website is mondaymorningdentistry.com for those that don't know, is helping people do that, right? There is some repetitiveness in there, I'm assuming. But if you actually do it and you follow through with it and you keep on top of it, are things you can master. Does that seem fair?
Yeah. I mean, the bottom line, even with first off, Monday Morning Dentistry is named that because I had always told myself if I was ever going to teach, I was going to teach stuff that people could take back and use it Monday morning. So there wasn't this lag, which is a lot of the coursework that I did early on. It just seemed like it was fluff, or there was so much stuff that you had to do to make it work, like you couldn't directly apply it. And at the time, financially, I wasn't doing great. So I wanted to be able to offer that. But then even within Monday Morning Dentistry, even within the courses, like we run an ROI challenge, return on your investment challenge, for our root canal crown course, because I know a lot of doctors come to courses and then they don't implement. So the same thing you're talking about, it's like, you know what to do, but you're not implementing. And so, we do as much as we can to try to encourage doctors to implement on the things that they've learned. And that includes me saying, hey, look, if you're having a problem, contact me. Let's work it out. Let's figure out what's going on. And let's get you doing this thing that you've decided you wanted to do, because that's why you paid for the course and you took the time off work and you flew out to see us. But let's get you doing the thing that you're trying to bring into your practice.
That's awesome. So During your time, I think you started Monday Morning Dentistry back in 2014 is what I read. Is that right?
That sounds about right.
So during that period of time, a lot of the challenges that dentists are having have stayed the same, right? So they're kind of reoccurring over and over again. What is one of the reoccurring things that hasn't changed? And maybe even since you became a dentist and opened your practice, what is a challenge that dentists have that doesn't ever seem to go away that you can help people get over?
Yeah, the one that I'm seeing the most right now is owner docs that have associates working for them that have varying levels of experience and training. Remember, we just came through COVID. I mean, it's 2023, but a lot of those guys that came through during the COVID years, they were missing some experiences and trying to get them kind of up to speed. I see that as one of the things that I see over and over. And then the flip side of that is that the associates are coming in and they know that they want mentorship and they're very clear about it, you know. And when I got out of dental school, we almost were kind of like, hey, you know, we just got out of dental school, we know everything, we don't need to learn anything new. Now with exposure to the internet and YouTube, young docs coming out know they don't know it all and that there's a lot of stuff they could be doing. So they're coming out, they're wanting to be trained. They know that that a dental license is a license to learn, as we like to say. And so, you know, the doc and the associate and they get together and like, yeah, this seems like it would be a good match. And, you know, we'll meet once a week and then we'll discuss cases and treatment protocols and that sort of thing. And that works for about the first month. And somewhere around month 2 or month 3, it all starts to fall apart. So you get a year down the road and what you have is an owner doc who's frustrated with his associate because he's not producing that much more than when they got into the practice, and an associate doc that's frustrated with the owner doc because they're not producing that much more than when they came into the practice, and the mentorship that they were promised, they don't feel like they got. And I see that just over and over and over again.
Yep. I don't think a day goes by on any of the larger dental social media groups where I don't see that same thing. I read one yesterday that had been in a practice for a week and this associate is very upset and actually talking about, I'm not going to go into too many details, but they're talking about how much are they owed. And I'm going to leave, but how much should I ask for? Like, and they've been there literally a week. And I think and obviously, who knows? There's always 3 sides to every story, right?
Yeah.
So who knows the exact details? But I think you hit it. You hit the nail right on the head. I think you have these associates, and it's true that they want mentorship, right? They want more help. They want to be taught. And I think when they're hired, they're telling the person that they're going to work for those same things. And that person is saying, yeah, but they don't really understand what that means, right? I think there's not clear expectations. So if you're an associate right now, or you have an associate and you're having this friction, we'll call it, how do you overcome it? So how do you fix this situation and turn it into a positive situation for both doctors?
Yeah, I think some of it is when folks think they want to bring on an associate, they don't think about what that process really looks like. So do you have an onboarding protocol to bring this person in? Do you have a protocol to teach them how you do dentistry so you guys can both be on the same page? Do you have a protocol of when you're going to, that sitting down once a week is super helpful because all kinds of stuff comes up. But do you have that carved out of your day? And is that time sacred? Or is it just at the end of the day and sometimes I got to go pick my kid up and drop off the car and do those kinds of things? I think all of those things are important. If you know specifically where you're trying to get to, so we have a hands-on 1-hour molar root canal belt crown course. If you know, hey, we want to bring root canal therapy back in, and what can we do to do that? We have a training course for that. If you're thinking this is just a young doc and I need them to kind of speed up and get up to and get on plane, as you know, like it's a boat, get on plane to where you're really zipping along. We have a very specific way of doing that. And just hanging out with the older doctor generally is not the way to do that. You sort of need to have some sort of a game plan that you can explain to this associate so that you can really educate them. I've talked to docs about, having them come in and do training on endo, and they'll tell me, well, like when I have an interesting case, I just call them over and I tell them what I'm doing. I'm like, that's great. But there's a whole start to finish to endo. There are so many details. And it's like, what's in the doc's head, what he's forgotten that he's forgotten. Okay. Like he's so competent that most of that competency, he's forgotten that it got developed and it wasn't there all along. And he just assumes that this associate knows these things. It's right. The old being unconsciously competent. And that's where the owner doc is. And he has to regress himself back to train his younger doc back in the days when you're consciously competent, but man, everything was a struggle thinking through it and making sure you're taking the right steps in the right order and knowing what the end points were and when to go to the next step and those sorts of things. So yeah, there's just a lot going on there.
And let me ask you this question, Dr. Nicholas. It is Nicholas. I said that correctly this time.
Yes,
correct?
It is. Yep.
I think I mispronounced that earlier. I apologize for that. Dr. Nicholas, you've gotten a new associate that's recently started working for you. During the process of bringing on an associate, you didn't discuss who's going to pay for education, right? Who's going to pay for CE? I think the incoming dentist looks at it and goes, I have all this debt. I'm looking for mentorship. I said I was looking for mentorship, and now I want to learn more. I want to learn this, or this, right? Who should pay for that? Like, how should you negotiate? If it wasn't negotiated prior to you coming on board, which I think is something that's often left out, how do you get over that hurdle? Because that's a challenge I see that doctors have trouble getting over.
Sure. So first off, if you negotiate up front, that's best. And in those cases, I always coach owner docs to make sure that if you're going to kick some money towards this, that the associate has equal money in, or at least a good chunk, so that you can't just walk away from it and go, that was great training. It's just not for me. You want them to have some skin in the game. If they've gotten on board and there's been no agreement of that sort, then it's a matter of, okay, let's talk. If you want to do this, that's cool. I'm willing to put in X number of dollars, but I need something out of that. I need to know that you're going to be here for X amount of time, that you're going to do X procedures. And you could do it either by saying, hey, we're going to say that what I kicked in, you sort of owe me. You don't really owe me, but you sort of owe me. And each month that goes down until it hits zero. And if you want to leave before that, then you need to pay me that piece,
Sure.
Or each time you do one of these procedures, it goes down by this much. And if you leave before that, you need to pay me that piece. And then that way, the associate has some kind of skin. It has sort of virtual skin in the game. And the owner doc doesn't feel like he's just giving out money and he might never get it back. It may not be a good situation, or the associate's just going to kind of whiff on it after they go to the course and go, it's not really for me.
Yep, that makes sense. On Monday Morning Dentistry.com, I just want to tell the audience really quickly, courses look fantastic on there. There's some of these that, me not being a dentist, would I think would really enjoy learning more about and taking. So I want to encourage our audience to check it out. I'm going to ask you this question. I ask this of a lot of guests. You've been on 30 years plus as a dentist, right? You've been a coach, a consultant. You've been on both sides of that desk, we'll call it, or that relationship. When you're trying to find somebody to help you, when you're looking for a coach or a consultant that's going to help you implement, right, that's going to help you take action, that's going to help you be accountable, what are some traits that you should look for, and what are some questions you should ask?
I mean, for me, the number one thing is, if you haven't done it successfully before, why should I hire you? And there's lots of consultants out there that are advertising to dentists and saying, oh, we can do this, we can do that, we can do the other thing. It's like, until you've been a dentist, until you've been the guy who owns the practice, runs the practice, is sitting behind the patient while your day is going south, while somebody just quit on you, while you can't find another person to come in and replace them, while you have an angry patient that wants to be called back immediately because they're angry about something that maybe a staff member did, or maybe that you said, or they couldn't get in to see a specialist, or until you've walked in that world where you've got 1,000 things swirling around you and it feels like everything's going wrong, you can't understand what it's like to really be a dentist and be in those shoes. Even the fact that when I'm supposed to meet somebody at a time, you and I were supposed to talk today at 1:30. I'm there. It's 1:30. I'm there. Okay.
Right.
A lot of other folks, 5 minutes this way, 10 minutes that way. It's like, it's not the same. When you do that dentistry, you train wreck a day, and you just can't do those things.
Yep. I will say that you were 1 minute early for today's recording, which means you're on time. I was on time, which means I was 1 minute late. So I appreciate you waiting that 1 minute for me. Your next course for your root canal build-up crown course, that's in Las Vegas, coming up in actually, I think that one's actually passed. Your next one is coming up in December, correct? In Maryland?
Right. December in Maryland, in my office. We'll be doing that one. We're really kind of psyched about we're going to be having a hands-on extraction course coming up in April in 2024. So that's
Wow.
where most of my free time is going right now, is getting that up and running. But we're super psyched about that and want to get that married together with the hands-on endo course. But that's coming up in 2024. But the next endo course, it's endo crown, actually. Root canal, belt and crown in an hour, is going to be in Maryland.
Yep, that's awesome. One more time, mondaymorningdentistry.com. Please check it out. Dr. Aaron Nicholas, thank you for coming on and sharing today. We really appreciate you.
Hey, thanks for having me on, Patrick. I appreciate it.